Hey everyone, welcome to my channel. In this video we talk about 3 kinds of exercise that boost heart health, and don't forget to subscribe and like and turn on the notification button. Being physically active is a major step toward good heart health. It's one of your most effective tools for strengthening the heart muscle, keeping your weight under control, and warding off the artery damage from high cholesterol, high blood sugar, and high blood pressure that can lead to heart attack or stroke. Women stretching before a bike ride. It's also true that different types of exercise are needed to provide complete fitness. Aerobic exercise and resistance training are the most important for heart health. Although flexibility doesn't contribute directly to heart health, it's nevertheless important because it provides a good foundation for performing aerobic and strength exercises more effectively. Here's how different types of exercise benefit you. 1. Aerobic exercise. What it does. Aerobic exercise improves circulation, which results in lowered blood pressure and heart rate, Stewart says. In addition, it increases your overall aerobic fitness as measured by a treadmill test, for example, and it helps your cardiac output, how well your heart pumps. Aerobic exercise also reduces the risk of type 2 diabetes and, if you already live with diabetes, helps you control your blood glucose. How much? Ideally, at least 30 minutes a day, at least 5 days a week. Examples: brisk walking, running, swimming, cycling, playing tennis, and jumping rope. Heart-pumping aerobic exercise is the kind that doctors have in mind when they recommend at least 150 minutes per week of moderate activity. 2. Resistance training, strength work. What it does. Resistance training has a more specific effect on body composition, Stewart says. For people who are carrying a lot of body fat, including a big belly, which is a risk factor for heart disease, it can help reduce fat and create leaner muscle mass. Research shows that a combination of aerobic exercise and resistance work may help raise HDL, good, cholesterol, and lower LDL, bad, cholesterol. How much? At least 2 non-consecutive days per week of resistance training is a good rule of thumb, according to the American College of Sports Medicine. Examples: working out with free weights, such as hand weights, dumbbells or barbells, on weight machines, with resistance bands, or through body resistance exercises, such as push-ups, squats, and chin-ups. 3. Stretching, flexibility, and balance. What they do. Flexibility workouts, such as stretching, don't directly contribute to heart health. What they do is benefit musculoskeletal health, which enables you to stay flexible and free from joint pain, cramping, and other muscular issues. That flexibility is a critical part of being able to maintain aerobic exercise and resistance training, says Stewart. If you have a good musculoskeletal foundation, that enables you to do the exercises that help your heart, he says. As a bonus, flexibility and balance exercises help maintain stability and prevent falls, which can cause injuries that limit other kinds of exercise. How much? Every day and before and after other exercise. Examples: your doctor can recommend basic stretches you can do at home, or you can find DVDs or YouTube videos to follow, though check with your doctor if you're concerned about the intensity of the exercise. Tai Chi and yoga also improve these skills, and classes are available in many communities. Why exercise matters for your heart health. Exercise lowers risk for heart conditions, improves mental health, and reduces visceral fat that can compromise your organs. Adult male using rowing machine at gym. The advice is clear-cut. Sit less and purposefully move more for heart health. But how does exercise help keep your heart healthy? How much exercise do you need? And what kinds of exercise should you do? All valid and important questions. We talked with preventive cardiologist Vikas Sunder, MD, and cardiac rehabilitation expert Eric Van Itterson, PhD, about what exercise does for your heart health and how to get started on a heart-healthy exercise program that fits your life. Exercise for heart health. The American Heart Association recommends at least 150 minutes of moderate-intensity exercise each week. That's aerobic exercise, the kind that gets your heart rate up for more than a few minutes. Additionally, an ideal exercise program for heart health also incorporates about an hour of strength training exercises per week. 2 sessions of resistance training for about 30 minutes at a time is a typical recommendation. Those suggestions may change depending on your health, your goals, and your current amount of physical activity. And reaching that standard could take some time. That's okay. The goal should be to first and foremost avoid sedentary behaviors that take up the majority of your day. Dr. Sunder notes, anything that people can do to move more than their baseline is important progress toward improving their heart health. Heart-healthy benefits of exercise. Aerobic and strength training exercises are both important for a healthy heart. When your heart functions in a healthy way, it's more able to interact and communicate with other organ systems. Dr. Van Itterson points out, your whole body benefits from well-oxygenated blood moving from the heart out to your body and back again. Exercise helps to improve that entire process. What specifically can you look for as heart-healthy benefits of exercise? Dr. Sunder and Dr. Van Itterson share just a few. Lowered risk of heart conditions. Getting your body moving has plenty of heart-healthy benefits that directly affect how your heart works. Among them, lower blood pressure, lower cholesterol, reduced risk of type 2 diabetes, reduced risk of heart disease, weight management, improved cardiorespiratory fitness. Scientific data has consistently shown that aerobic or cardio-style exercise improves not just the circulation within your heart, but also the circulation throughout your entire cardiovascular system. Dr. Van Itterson shares, that ability to circulate blood in an effective and efficient way typically leads to powerful reductions in cardiovascular risk. Lowering visceral fat. You may have heard that a round midsection, or so-called apple body shape, can be a sign of potential health problems. And it's true. A high waist circumference, the measurement around your belly button area, can be a sign that you may have higher than healthy levels of fat deep inside your abdomen, surrounding your organs. It's called visceral fat, and too much can be dangerous to your health. High levels of visceral fat can have detrimental effects on the cardiovascular system and increase systemic inflammation. Dr. Sunder affirms, aerobic exercise and strength training exercises that incorporate your core can help burn fat and increase the overall proportion of lean muscle throughout your body. Improved metabolic rate. Strength training exercise can help your body gain more lean muscle mass. And muscle helps keep your body and heart healthy by improving your metabolic rate. In other words, muscle helps your body burn calories more quickly, even when your body is at rest. Unlike fat cells, muscle tissue is metabolically active. Dr. Van Itterson explains. That means that when you have a higher muscle mass, it's not only during the literal act of exercise that your metabolism revs up. It's working almost all the time. Improved mental health. Exercise releases feel-good hormones called endorphins that help improve your mood and reduce your stress levels. That's important because your mental health plays a big role in keeping your heart healthy. And as exercise makes you feel good, it should help with keeping up your motivation to do more exercise consistently. We know from studies that mental health concerns like anxiety and depression are associated with increased risk of heart attack, stroke, and other cardiac events. Dr. Sunder says, and regular exercise can greatly decrease your risk for anxiety disorders and depression. Exercise is like the beginning of a chain reaction. It increases endorphins, which makes you feel happier. In turn, that lowers your stress, which improves your mental health. And improved mental health lowers your risk for a slew of heart-related health conditions. Heart-healthy exercises to try. That's it for today's video. If you enjoyed this content, don't forget to like and subscribe to our channel for more fascinating insights. Be sure to hit the bell icon to stay updated with our latest videos. We also encourage you to leave a comment below, sharing your thoughts and suggestions for future topics. Thanks for watching.